going to start and any timeline on getting our people much needed assistance, before a few weeks or not. Anyway, so we got a whole bunch of stuff. 626, something that I've been seeing on Facebook lately that's pretty interesting is Dr. Peter Lombard. And, morning, Doc.
Good morning.
Morning.
So you were basically one of my friends described you to me as a numbers data geek.
Well, I'll take that compliment. Yeah.
Right. And so what you've been doing on your Facebook page is kind of compiling a lot of the data here with the COVID-19 testing and results. And you've been also kind of doing your own trajectory, right? And what can you tell us about that, Doc?
Well, I've been doing my best. I'm not a statistician. I'm not an epidemiologist, and as well as I think I can do things, I know I'm probably not doing them the best way. I hope I'm somewhat close to what someone else would be doing, but I can say, from the data that's available to us, I think it's a fairly accurate representation of where we are and where we're going. At least if you use the rate of daily growth, which I've been putting on there. Now, at some point, that's not going to be a reliable metric for what's going to happen, and that's when a lot more sophisticated models need to be used. And that's the scary part. I mean, if you look at those models, they can really show an ugly picture of what the next few weeks are going to look like. And I think that's probably what the leadership is looking at as well, in terms of trying to prepare for the worst, appropriately so.
Doc, layman's terms, what's your projection? What do your stats look like for the next few weeks?
Yeah, well, I think I posted something last night. I think we're kind of at a crossroad here. We're at about a little over 2 weeks from when our lockdown happened, and the fruits of what happened 2 weeks ago is going to be apparent over the next few days. And if we start, we very well could be at the start of an exponential growth phase. However, I just haven't seen any signals in the data that show that that's happening, unless there's something else out there that I don't have access to. So from that perspective, I'm kind of hopeful that we're not going to see the exponential growth. That being said, the alternative is still bad. I mean, we're still looking at potentially overwhelming the resources within a couple of weeks, but it's certainly better than what the other projection would show. Exponential growth at this stage would just be catastrophic. I mean, it would just be, again, you can't even fathom how bad things could be if that happens at this point. I want to be optimistic, but and again, I have a hard time seeing in the data that I have any signs that this is happening. But there's definitely limitations to the data that we have. We have a small sample size, and that just introduces some noise. And so, what that means is there may be, if it's happening because of our small sample size, we just may not be seeing it yet. And when it happens, it'll come on us very quickly. So the next few days are very, very critical.
Doc, there's something here. I was just looking at your Facebook post. Watch the hospitalization numbers closely. They may be more important than the positive cases. False negative tests may be more prevalent than initially thought. New cases may have been missed. Mm-hmm. Can you unpack that for us?
Yeah, well, I've seen some reports lately that the false positive rate. The false negative rate might be as high as 30%, and that's a pretty high number. And it's not necessarily because the test is a bad test. If they submit a sample and it's got some virus on it, the machine should pick it up with a very high level of sensitivity and something called specificity. But the problem is if it kind of depends on what the viral load is of the patient and where the swab is being taken, if it happens to be swabbing an area where there happens to be a lot of virus or not. And so that's typically the reasons why you might get false negatives. But you can imagine, somebody thinks they're negative and they go about their day as if they think they're okay. But I'm sure they're advising people about this possibility, and hopefully that means people are being more careful. But if there are more positives out there, what would that do to our numbers so far? It would actually show us that we have a higher rate of daily increase, and then our predictions would potentially show us that we are indeed following more of an exponential growth phase. So that's hospitalizations. From previously published data, you can see that they're about 20%, 20 to 30% of all cases. So if we have 20 hospitalizations, you might predict we've got 100 cases out there, and we're only picking up a certain percentage of them. So that could be consistent with the fact that we're not testing enough,
right,
and or we've got false negatives that are true positives. So that's why hospitalizations are important, and that's why knowing how. They sometimes the hospitalization data that we get in the press conferences, I don't feel like they've really defined hospitalization as well as they could.
Right.
I think they're counting the SNU patients as hospitalizations, and that's kind of an important point to me, because are those patients are they healthy enough to be on home isolation like some of the other patients? If they are, then if they're trying to use some of these models, I'm not sure it's appropriate to call them hospitalizations at this point. So it gets complex, I know, and I've been up late at night and can't sleep thinking about the numbers and trying to figure out what am I missing here.
Doc, I mean, I'm not a numbers or stats guy, but how accurate a read can we get on this when we haven't done the level of testing that we're seeing in areas where they're doing a little better at flattening the curve?
Well, I think one thing that I think we're doing well is the consistency of applying the testing protocols. So they said, here, we're going to have this criteria. It's pretty strict. And I think they've been applying it consistently across the board. And I say that because our positive test rate has been very, very stable. So it's always been around 14 to 16%, around 15%. 15% of all the tests that we run, 100 tests that we run, 15 of them are positive, pretty much straight across the board from the very beginning. So from that perspective, even if we're not testing as many as we would if we had more tests, if our criteria was a little bit more lax, I still think it's a representation of what's out there, and that's another reason why I'm looking for a signal that we're starting to hit a growth phase, and at least by the number of new tests, we're just not seeing the increase that would suggest that's about to happen. So when we do get new tests, if and when that happens, I'm sure it's going to happen at some point. I don't think it's ever going to be enough for us to do the type of mass testing that they do in South Korea. And we can talk another day about how we might be able to implement mass testing or not. It may actually not be a good thing for us if we can't isolate people.
Yeah, I was thinking about that. It's like we go test 1,000 people, find out, at 300 of them are positive, and what are we going to do with them? So.
Yeah. I think the places that have been successful with mass testing is they have a centralized isolation. If it's worth it to do that, and we have the resources, then maybe that will be the right thing to do. Or smartphone tracking these people, because that's the other method that works when you do mass testing. But in the absence of that, there's definitely an argument to be made that you just continue to do your targeted testing. You're going to just be very strict about what you do with the people that are either positive or that you suspect might be positives. And that keeps people off the streets from, trying to drive into the clinics to get tested for any little symptom that they have. But the problem with when we do increase our testing and our numbers go up, it's really going to make the previous data less meaningful. We'll be sort of shifting to a different type of curve, and where our percent of positive tests has changed, and so that's going to make a lot of the work that's been done so far less applicable to the numbers going forward.
Dr. Lombard, I wanted to follow up on the letter that you wrote to the governor, I believe it was over a week ago, calling for more transparency. Mm-hmm. Did you ever get a response?
Yeah, that's it's been almost 2 weeks now. I never got a direct response. I've had some people in various positions reach out to me and say, we hear you, we're trying, and things are definitely better than they used to be in the early days, Yeah. And I thought a lot about this, and I know they're super busy. And when this is probably the DPHSS guys and gals that are working on this, and when they've got to do contact tracing and surveillance, and it's all they can do to manage that. The amount of time that they put into reports, making sure they're accurate, giving every little piece of data that might be useful for somebody in the public. I can understand they've got priorities that they have to consider. So, I'm happy that things have improved. I wish that there was more consistency in the type of data that comes out. The metrics I've always been asking for is, can you please be consistent with telling us the number of hospitalizations and ICU patients every day? It'd be nice to know how many people are on ventilators. I don't think these things are very, I don't think we have to worry about privacy issues.
Right,
these questions.
Yeah, this is information that we see in a national report.
Oh, yeah. Absolutely. Other states are doing a really nice job of presenting this data, but it takes some extra time. I think it would be relatively easy for them to have one of their staffers put together something that's consistent and provides us with a little bit more information. I mean, the other thing that would be really great to know is for the new cases, what's unique about those? Is it a cluster? Are they related to any of the prior cases?
Right.
These cases that are brand new and we have no idea who their contact was, because that would be a bad signal. That'd be a very bad signal to have a lot of those.
I've asked about that, Doc, and I think the response that we got was basically they put out that advisory that if you've been to a gathering or even a small I'm not sure the wording, a small celebration, that you should consider yourself positive. And so I don't know if they continued the trace investigations if we're operating under the assumption that everybody out here is positive.
Yeah, and I think that's appropriate. And you have two extremes. If you consider everybody is able to self-isolate perfectly, we'll starve the virus. It'll go away within 2 weeks. It'll be gone, and we just have to take care of the people that have it at the present time. And that's the goal that we should be thinking of. Am I self-isolating perfectly? If I happen to have it and I'm asymptomatic, am I not going to pass this to anybody so that this virus will starve out because it doesn't have any new host to spread to? And we're definitely not there. But where are we between no restrictions, no lockdown, and that extreme? It's really impossible to say. And all we can do is look at the number of cases coming in to try to guess how well we're doing. And I don't envy the governor. She's got some tough decisions to make based on very limited data.
Right. Just real quickly, Doc, do you feel that we need to take this to the next level in terms of shutting down the island?
Like I said, I think that the next few days are going to be very, very critical. If we do start to see some true signals of an exponential rise, then absolutely. That means that at least what we were doing 2 weeks ago was not adequate. Now, we're probably doing a better job the last 5 to 10 days than we were the first 5 to 10 days. But is it still good enough? And if we do start to see an exponential rise in the next couple of days, then absolutely we have to be even more strict. And there's no question. Right,
Doc. So there's going to be we're going to get Dr. Cabrera right on the line after you. There's going to be a big presentation. The governor kind of teased it yesterday during the press conference, and we're going to find out more. I know Dr. Cabrera is kind of leading the charge on this, and so we're going to find out exactly how much he can say about what to expect this afternoon. But wanted to just get you on the line. I see how you're crunching the numbers and studying the data, and we have some statisticians. A shout out to Ken Nicholas from our digital team. He's been doing all our graphs, but just wanted to get your perspective on your Doc. So thank you so much.
Yeah, thanks for having me. Take care, guys.
Thank you.
You keep in touch, man. You got my number. Shoot me a message, or let me know if you see anything interesting with numbers.
Okay, Chris. Stay safe.
Okay. Wash your hands.
Bye-bye. Bye-bye.
Okay. All right. 640. That's Dr. Peter Lombard. Yeah, we're gonna get Dr. Felix Cabrera coming up here after the break. Bree?
No, just anytime Dr. Cabrera does a presentation, the first one, it was like, oh man, so I'm just kind of worried.
Right.
when the governor was like, and Dr. Cabrera will be doing a trajectory update.